Hello, everybody, and welcome to Closing the Deal Dental Podcast. Our next guest is Dr. Usma Ansari. Dr. Usma Ansari is an accomplished dentist, mentor, and leader known for blending clinical excellence with an energetic, forward-thinking approach. She is the founder and owner of Lowe's Island Dentistry and founding partner with Guardian Dentistry Partners and CEO of Smile Concierge Services. Her career includes leadership roles as dental director for Konikoff Dental Associates and Monarch Dental Associates, and distinguished service as a major select in the U.S. Air Force. Dr. Ansari extensive training spans the Dawson Academy, Pankey Institute, Spear Education, and advanced certifications for implants, Invisalign, Botox, TMJ therapy as well. She is a fellow of the Academy of General Dentistry, a diplomat of the International Dental Implant Associations, and John Maxwell certified trainer and speaker. Dedicated to elevating the dental profession, Dr. Ansari now speaks on leadership, communication, patient experience, and case acceptance, equipping dental professionals with strategies to grow their practices and careers with confidence. Dr. Ansari is passionate for mentoring the next generation and brings bold insights on leadership, patient experience, and building a career that you love. Hello, everybody. My name is Elijah Desmond, and I'm your host of Closing the Deal. Today, we have one of my friends and a doctor that I've heard personally speak at some of my events. We're in for a treat. I'm super happy to have you, Dr. Usma Ansari. And I got to tell you, I feel like we have known each other for 5 years now.
Yes.
And when I was thinking of the perfect people to interview, you were like top on that list. And so super excited to hear about your journey. And thank you for coming.
Thank you so much, Elijah. I really appreciate it. It has been 5 years. Wow. I still remember the first time we met. It's been a fun ride.
Yes, absolutely. It's been lots of fun. We're going to start this out the way we always do. And, if you could go back and resell your practice, if you could start all over, resell it, and you had the opportunity to work with us at Dental Pitch, and you were coming into a room, and that room was full of potential buyers, Guardian being one of them, and they all were standing up clapping for you coming into a walk-on song. What would your walk-on song be and why?
I've thought about that a lot. It's a good question. For me, I think the walk-on song would be Happy by Will Ferrell. Just like the realization that I had built a value in my practice. And then, we were talking about the next chapter. I think dentistry, we go through chapters in our careers, right? You get out of dental school, buy your first job, and then, first practice, and then first multiple practices, and then joining a DSO or a DPN. I think it's just another chapter. And I was just so happy to be opening that chapter or that door.
Okay, awesome. Well, for those of you who don't know you after, they just heard your amazing bio, by the way. But for those of you who don't know you, can you give us a little bit of background? Where'd you come from? How'd you get started? What was your journey in your practices before I give you some more in-depth questions? Just give us an overview. Catch us up to from pre-dental school till now.
Sure. I went to dental school in the University of Alabama School of Dentistry, UAB. I was the first Pakistani female to graduate in the 1998 class. At that time in 1998, I think females were a minority graduating from UAB, but now I know there's a lot more females. So I was super excited to have graduated. I left dental school to join a corporation. I went and joined Monarch Dental Associates. I worked there and became a dental director of 2 offices, the office on Fannin and 280, and then had also worked in other corporations like Castle Dental and stuff like that. But I left that type of practice to join the military, United States Air Force, right before 9/11, because I didn't want someone to change my treatment plans. I didn't want the pressure of the sale. So I joined an ideal environment, which, military, there was a lot of focus on education. I think I developed my passion for education through the United States Air Force. And then after my career in the military, I then joined a group practice that was very different than anything else I had experienced prior. And then I stayed in that practice for 10 years, grew as a dentist, did things like Dawson, Pankey, Spears, was a Spears junkie. And then that opened a whole new chapter in my life of the type of dentistry I wanted to do, which led me to owning my own practice.
What was that group that you practiced for 10 years?
Konikoff Dental Associates in Virginia Beach.
Do they still exist?
They do. They're part...
Konikoff?
Konikoff. David Konikoff.
Okay.
Yes, I'm sure you've heard of their name too. I think they're with I'm not sure if they're with DCA.
They were acquired though. Okay, got it.
Yes, they were acquired. And then I moved over to Northern Virginia and bought my own practice, Lowe's Island Dentistry. Worked here for 10 years, learned a lot about business. And growing a practice and EBITDAs and production per chair and all that kind of stuff until I joined Guardian Dentistry in 2019 with my partners, Hisham Barakat and Sana Barada.
And how many practices did you have at that time?
So my friends, Dr. Barakat and Dr. Barada, we had practiced together at Konikoff Dental Associates for 10 years and then owned our own practices. So we were friends for 20 years. We had individual practices and we put these practices together when we joined Guardian Dentistry Partners.
Let's talk about that for just a second. So how did that work? You were friends already. You've had a practice for, 1 year, 2 years, 3 years. You grew your practice to, I would assume, somewhat successful practice, right? And with the focus of what type of dentistry, you all three got together at once, all together for 1 to 2 years and integrated and then sold to Guardian. Give me a little more details about that process.
So, because we had all grown up in the same practice, we work a lot alike. We each had our own interests. My interest was cosmetic dentistry. Dr. Barada's interest was TMJ, ortho, and Dr. Barakat's was implant dentistry. So when we were in Northern Virginia, we had our own practices that had our own focus. But because we were very much like-minded entrepreneurs and friends, we would talk together, motivate each other, make sure we're looking at the right things. And when we were looking into this space and thinking about joining Guardian, we joined together as a package kind of thing.
Okay. Got it. So let me give you an example. Sometimes there's dentists that have friends that want to sell together, but they sell so they can sell for a higher multiple of EBITDA. And so but prior to selling, they get together and they integrate their practice. So for example, they all get under the same practice management software. They all get central revenue, revenue cycle management.
No, that I think all happened later for us.
Okay, got it. And were you the original people, or what number were you for Guardian when you sold?
So we were, I think, if I'm not mistaken, the third or fourth. Michigan came before us. So my partners, Dr. Noah and Oleg, had joined right before us. I think we were all talking. I think numbers or date-wise, maybe there were 2 more practices before us, but we all integrated almost at the same time.
Okay, got it. And so 3 or 4 before. And what made you join Guard? Why Guardian? What was the big thing that made you join?
Well, I had, because of attending a lot of continuing education and going to a lot of conferences about the business of dentistry, I knew that this was definitely something that I needed to look into sooner than later. When I joined Guardian, I think for me, it was the thought of like-minded entrepreneurs building the practice of their dreams. For me, I wasn't done practicing dentistry. I knew that this is something that was the next chapter in my life. I very much enjoy doing dentistry even now. I think Guardian Dentistry allowed me to be the type of dentist and take some of the things that I didn't like doing off. But then at the same time, I knew the person who was making a lot of business decisions was guided by a dentist. Like there was a dentist at the top that was helping making these decisions. It was like-minded entrepreneurs. It really was. And I think that's really what gravitated Guardian growing.
Right. Are you able to discuss like what, like how the deal structure was? So for example, like, did you sell 100% of your practice? Did you sell 60% of your practice? What is the ownership like? And if it's okay, if you can't, but what does this typical Guardian deal look like?
So as a founding partner, I sold 100%.
Okay. Got it. And when you sold 100%, then did you own equity in Guardian themselves?
Yes.
Okay, got it. And that's awesome. And there's multiple DSOs that are just like that. But oftentimes people are looking because like some people will not buy 100%. Many groups will not buy 100%. Some will only buy 51 or 60%. Or 65 or 70. You're seeing.
Yes, I know there's many different types of deal structures out there. And I know that even those exist in Guardian. I think, at the time we were founding partners, like it was Michigan and us. So I'm sure the deal structure at that time was a little bit different than what, over time it has for many other DSOs.
And how many practices now are with Guardian?
174 that I've heard of.
So I remember it was like just over 100 not too long ago. So you are growing fast.
Yes. And I think the key thing is that, it is definitely doctors that are still passionate about doing dentistry, want to do dentistry, and want to grow together. So it really has afforded me the ability to focus on things that I like doing and take away things that I don't like doing. I like speaking. So coming to see you and speak at Dentistry's Got Talent was one of the, I think that was the first year after I joined Guardian.
Wow. So it gave you a lot more free time to do those type of things.
Right.
First off, how long did you build your practice before you sold it? And how did you prepare for that sale? What were the steps that you took to maximize the value?
I think I had owned the practice for almost, I'd say 9-10 years before joining Guardian. I had a great accountant.
You don't age.
Thank you.
You don't age because you just told me about 3 things that were 10 years. And I'm like, I don't know if that maths. Okay, sorry for the interruption. Keep going.
No, thank you so much. I appreciate that. I think the way that I got ready for the sale was looking at production per chair. Doing procedures, keeping things in-house. Really the thing that helped me is I grew as a dentist and invested in my education as a dentist. So I was able to do more things that I enjoyed doing, and really was able to offer patients a lot of benefits by being able to keep everything almost in-house.
So looking back, is there anything that you would have done differently at your practice prior to selling? Like if you had advice, somebody is preparing to sell and they're not ready to sell for another 6 months or a year. What's that thing or things that you would have did differently?
The one thing that I would say for me, right, when I was selling or looking at selling, I was also looking at buying a second practice. And, I would, just from the perspective of what it was like to own 2 practices or manage 2 practices and, what impact could I create in 2 practices, right? That's something that I maybe felt like, if I were to do it again, it'd be nice to have 2 or 3 and see how many practices before I merged into this. But not everybody has to have multiple practices. We have many partners that have 1 practice. But since you asked that question, if you have more practices, I think your profit is a little different too.
Got it. Makes sense. So you would have scaled a little bit more prior and had more practices.
Yes, maybe.
What did you do to maximize or prepare? So like, did you know coming up like a year prior, like, okay, I think I'm going to get ready to sell. I'm going to grow my EBITDA, right? Or I'm going to prepare to sell. So I'm going to do this and that different. What did you do to prep?
But to prep, like I was looking at different organizations, and in order to prep, I was just trying to figure out, okay, what does everyone look at? I mean, like, do I have to have 4 operatories, or do I need to have 2? Or is it okay if I have more than 5 operatories, and what does that look like, right? And if I'm one provider, how many hygienists should be working with me, like for the revenue to support the dentist? If I have 2 providers in the practice, 4 hygienists. So like I was looking at that kind of stuff. I did look at some organizations where 3 chairs or anything less than 4 chairs was just, they were not interested. There was a certain level of revenue too that I found when I was doing this exploration that one had to have. And it was certainly above $1 million. You had to be doing above $1 million.
Yes, that is very interesting. Speaking of the above $1 million. So there are now a lot of groups that are over 1.5 million.
Right.
Some groups will allow as low as 800, and there's like very few that are like 700, 600 is like one. And we have 73 buyers. So, and how many operatories did you have when you sold?
When I was looking at this, I had 4, but then I was like, okay, I need to have a 5th. So I plumbed and set another room. I took out my office and made it into an operatory, thinking that was going to be something else that I'm going to add. I had 2 providers and 2 hygienists. So 5 operatories, 4 working, and the potential for a 5th.
That's awesome. And that is extremely good advice for anybody listening. I mean, we have 73 buyers, right? And so if we said 4 operatories, so if you have 3 operatories, it's out of the question. And by the way, there's hundreds of private practice dentists that we have as buyers, but 73 is sophisticated groups, et cetera. And so when you say 3, out the question. 4 is out the question for many. 5 is the lucky number to where you start getting a lot, like way more. We'll say over 50% or 60% of the buyers want 5 or more. And even the fact that you knew enough, like you talked to the right people, you just plumbed it. You sound like you didn't even build it out. And
I didn't build it out.
And you turned your office. I mean, that was so smart, really. And a lot of times people just don't know that. They weren't given that advice. And then as far as the numbers are concerned, you're right. You did have to really be over that $1 million mark. And there's also the misconception, some dentists don't realize it. They get to the $2 and $3 million mark, and they want to sell to a private practice dentist and not sell to a group. And the fact of the matter is there are extremely little amount of private practice dentists or associates or new grads coming from college that have the ability to buy a $2 and $3 million practice. And so
that is very true. Not only the ability to buy, but I would think the ability to manage.
Yep. Yes, exactly. So if you could give some advice or just like experience shares on, okay, you didn't sell to a private practice dentist, you actually sold to a group. And can you like tell everybody what the changes were at your practice? So like, because I can tell you, if you've seen one DSO, you've seen one DSO. They're all different. And I love Guardian. Guardian has an extremely good reputation. And I can't say enough good things about Guardian. But people are scared because there has been nightmares from many different, groups and DSOs.
Of course.
Can you tell everybody like, all right, you sold to a DSO. What was the changes that you actually felt immediately or 6 months later? What was the difference between having to practice yourself versus selling?
I think the changes that I felt immediately, and one of the primary reasons for doing this is support for the team. I'm a very growth minded dentist. I want not only growth for myself, but I wanted growth for my team. When I purchased the practice from my previous owner as a private practitioner, I felt like the team was all afraid that they were going to, they'd worked with this dentist for 13 years and now he sells to me and now the benefits change and now I can't support the 6 weeks paid time off he used to give and the high salaries and this, that, and the other. And then, there's a lot of fear when I purchased the practice. Although I kept everything going for quite some time, 4 years to be exact, of the previous benefits. I think when I sold to Guardian, one of the key things was the opportunity of growth for not just myself, but for the team, that the team felt. Whether it be HR, whether it be time off, whether insurance, health benefits, insurances, disability, those are some of the things that as a private practitioner, I may not have been able to offer everything that was out there. So their benefit packages definitely became better. The 401k contributions, definitely. And I think some of the things that they immediately felt is supported, right? I mean, what if an assistant called out sick? There was somebody else from our organization that could fill in that spot. I felt less stressed about that phone call in the morning. Dr. Ansari, I can't come in because, my child is sick and I have this big cosmetic case that I'm supposed to do. And now I have to find an assistant at 8:00 and work with temping agencies. So I definitely felt less of that stress. But because all of our practices talk to each other. And if there was an assistant, somebody's schedule was light, then that assistant could come and help me take care of my patient that was set in the chair without necessarily using a temping agency or scrambling at that last minute before your 8:00 patient shows up. So that definitely felt better for me.
Got it. What about things like revenue cycle management? Do you have to deal with?
Oh, yes.
What about that type of stuff or marketing? Can you give us a little bit of insight on that?
So definitely revenue cycle management, insurance renegotiations, and marketing. These are all things that got centralized over time and took that pressure off of me to have to manage that. Marketing is one of the things that I really like. So I still get to dabble in that and work with the marketing team. So the things that I enjoyed, I kept up with. The things that I didn't enjoy, I didn't really enjoy figuring out who had the cheaper deal on gloves. Was it Darby or was it Patterson or was it Henry Schein? That was, I think, hours that I didn't need to be spending. But now being part of Guardian, yes, absolutely, that has been a benefit.
Awesome. Now, can you talk about, there's the benefit of joining a group because of group purchasing, right? And essentially, when you are buying for 180 practices, you get a better deal. Yeah, you get a better deal on the glove. You get a better deal on your lab, that type of stuff.
Especially in times like COVID.
Yes, absolutely. When the glove, it's crazy. That was a time when I was actually looking at dabbling into the glove business because it was a good one to be in. Well, at the end of the day, for dental pitch brokerage, we are not just selling practices. We're actually giving practices 45 to 50 different companies or vendors that can help them to grow their EBITDA. And they don't even have to be with a group yet, essentially. And so,
oh, wow.
Yeah. So things such as supplies and labs and merchant fees, marketing. I mean, there's so many different resources to grow. And ultimately, I think the big question is did you see an impact in the group purchasing power?
Absolutely. Whenever you have group purchasing, there's always going to be an impact because of the buying power. Not only do you get better deals for different things that you need, but you also end up spending less money because of the negotiated fees. Better reimbursements too.
Okay, that's awesome. So I'm just trying to give people a peek into the future. Like, what is it actually going to be like for them? Because there's a lot of people that are scared to sell because they don't know what's going to happen after. next question is did you happen to work with some sort of wealth advisor in advance and prepare for it? Like, did you know, okay, I could sell? I spoke to a wealth manager or a wealth advisor in advance, and now I know I'm able to sell my practice. Did you do that, or would you recommend a dentist do that prior to selling?
I did. To be honest with you, Elijah, I was very involved in meetings, business meetings, and through the coaching and the business meetings and the mastermind groups that I was a part of, I did get exposed to wealth management people who helped me look at the practice from the right perspective and start thinking along the lines of, okay, what is the next chapter? And in order to get to that chapter, what do I need to do? At the time, I believe the company name was DDS Financial that I worked with. Brent Sawyer had worked with me in looking at, getting my practice ready for this type of an event. I also had a very personal friend, Amar Alian from iSynergy company, who has been my friend since Virginia Beach. And he was also very instrumental in helping me think along those lines. So having somebody and learning from somebody is a very key element to be prepared for what's coming up.
Absolutely. Did the sale allow you to pursue other new passions or career opportunities, and how so? What are you doing now? What's your every day or every month look like?
Oh my gosh, the sale, absolutely. My husband's a psychiatrist, all right? And I think, when I had owned the practice, my husband used to say that I had changed a lot. I carried the stress of the practice. I would bring work home. And then after I've joined Guardian Dentistry Partners, I think my husband is the happiest because he thinks that I'm myself now. I get to do the things that I enjoy doing. I wish that I had done it sooner. I think, my kids missed that part of me when I was building it. And the kids grew up and they're now, I have one daughter who's going to dental school. But I wish that I had done it sooner, but it definitely allowed me to do other things that I enjoy. I now work 3 days in my practice. I don't work the 5 days that I used to work. I make more money. I go home happier. I get to work in things that I enjoy. I still stay in touch with marketing. I look at, performances of different practices. I am involved with evaluations, clinical chart audits. So I do clinical chart audits. I actually created a small consulting company where I get to speak, coach, mentor other doctors. So I have really enjoyed this next chapter of my life.
That's awesome. That's awesome. A lot of people are wondering, what's it going to be like after? And that's a perfect, it's actually a picture perfect. It's not always that good, guys. That's it. It's not always that good. But it's amazing what you're able to do. It sounds like you're really fulfilled. And I think I'm going to end on saying, what's next? What do you see next in your future in the next 5 to 10 years?
To be honest with you, I still really enjoy Guardian Dentistry Partners, and I intend to grow with the Guardian Dentistry Partners. I hope that I can grow my coaching and consulting business also. Love doing clinical chart audits or mentoring young doctors. I feel, having a daughter in dental school has given me a new wind in life in dentistry. I think about the young dentists that are coming out of dental school and, what they will need to become a successful dentist or to enjoy the profession as much as I did. So I hope that I can be there for them.
Okay, awesome. Good stuff. Well, thank you so much for joining us. For anybody who is interested in getting in touch with you or reaching out to you to ask you any great questions or maybe even be interested in you as a coach or consultant, what's the best way to get a hold of you?
I respond really well to text messages. I am a multitasker. So the simplest way is to just text me at 757-667-1380 or check me out on my website, www.smileconciergeservices. And then, of course, I'm on Guardian Dentistry Partners website too. So can be reached there too.
All right. Well, thank you so much. We really enjoyed having you and your wealth of information.
Thank you, Elijah. Really appreciate the opportunity.
Absolutely. Bye-bye.